Hello, Howard community. My name is Connesia Hansford. I'm a psychology intern at Howard University Counseling Service, and today I want to talk to you all about racial trauma, also known as race-based stress, race-related distress, or racial injury. According to Dr. Lillian Comas Diaz, racial trauma is the real or perceived experience of racial discrimination, threats of harm or injury, and humiliating and shaming events to oneself or others. In other words, racial trauma is a psychological experience of encountering racism directly and witnessing or hearing about racially traumatic acts that involve loved ones, those in your community, or anyone whose identity aligns with yours. According to Dr. Robert Carter, who created the race-based traumatic stress symptom scale, negative or dangerous racial experiences can yield symptoms such as depression, anger, maladaptive physical symptoms, avoidance, hypervigilance, intrusive thoughts, or low self-esteem. These symptoms can impact interpersonal, academic, and professional aspects of a person's life. Black Americans report racial discrimination and experiences of racism more frequently than other racial identities, and we know that there's an inverse relationship between racial discrimination and well-being or life satisfaction. Due to current technology and social media, we have unprecedented and unfiltered access to the frequency of anti-Black racism, which increases the prevalence of racial trauma. So today I want to give you guys some tips for coping with racial trauma. My first tip is to understand your experience. Having language to understand and articulate your experiences is powerful, as confusion related to your internal experience increases feelings of distress, helplessness, and hopelessness. So find books, articles, or podcasts related to racial trauma to increase your sense of awareness and agency. My next tip is to engage in self-care that is protective and empowering. Understanding your nuanced experience of racial trauma or the specific symptoms that you're experiencing will help you be intentional about your self-care practices. Engaging in self-care can range from limiting your social media use in an effort to relax, decrease anxiety, or avoid racial trauma triggers, to engaging in activism or advocacy that will increase feelings of empowerment and agency while decreasing feelings of hopelessness. Whatever you choose, remember to be mindful of the function that it serves and be kind and compassionate towards yourself as you figure out what you need. My next tip is to reach out for support and help. When experiencing psychological distress, there's a tendency to turn inwards and isolate from others for fear of being judged or made to feel worse. But post-traumatic growth best occurs when you can share your narrative and feelings with other people who can help process your feelings, join in coping activities, and or increase your sense of belongingness. Therapy is a really helpful way to get support and understanding around your trauma experience, and you can use the first few sessions of any therapy experience to inquire if your therapist understands racial trauma and the subsequent treatment in a way that feels comfortable to you. My last tip is to find spaces where your experiences are heard and validated. One symptom of racial trauma is feeling as if your racial identity or experiences will not be accepted anywhere, and as a result, it's really important to find spaces that challenge this notion. Find time to spend with individuals or join organizations that serve as safe personal and professional spaces where you can share your experiences, process your thoughts, and hear and learn from others, or engage in joyful moments that combat racial trauma symptoms. As always, please be compassionate and kind to yourself as you navigate any race-related distress that you're experiencing. Self-care really is key to maintaining a sense of sanity and having the energy and ability to fight anti-Black racism in whatever way feels right to you. Thank you for listening.